So, Dr. Rahul, I'm asking you one more question, and this is that Ankit Sharma is asking a question that I had breathing issues and itching after the first dose of Covaxin. Then I took Montelukast with levocetirizine for 15 days. Should I go for the second dose?
So, Ankitji, this is not a contraindication. You can certainly go for a second dose, but it would be good to get your complete blood cell count done and see what your eosinophil count is. And that would actually give you understand us that why did you have that breathing issue or the itching which happened. Usually, if you have eosinophilia, it may have just precipitated, but certainly no vaccine has gone ahead and given a itching or a breathing issue for 15 days or so. So I think you need to just be investigated that why the breathing issue was there. Did you actually catch COVID just immediately after the vaccine, and did the symptoms present at that time? That's another way of investigating. So I would say that, Ankit, you please speak with your general practitioner, family physician, or a physician, and get yourself tested before you go for a second dose. I would like to also ask you a question, sir, and maybe I will answer one Aparna ji's question. Aparna ji is saying that her father is 83. He is on anticoagulant Xarelto, 15 milligram, and his INR is 2.3, and he had COVID in the April month, and he's still taking anticoagulant. Can he take vaccine? Aparna ji, I have one question for you actually. If you take Xarelto, usually the INR should not change because these are all newer anticoagulants. They act in a different way. So if your father's INR is 2.3, please go and investigate why is his INR 2.3. Please speak with your doctor. Please speak with your physician. It is not something which is normal. So I would definitely investigate his liver. I would definitely get him tested up with the physician. And probably he does not need Xarelto. The Xarelto can be stopped if his INR is 2.3 because he's probably having already some amount of coagulopathy there. And adding a Xarelto 15 milligrams per day, which is rivaroxaban, may not be necessary at all. So first, I think you need to show him to a doctor, and then we can take up the issue of vaccination. So there are two questions for you, sir. Rishikesh ji is asking, breakthrough infections, are they so common? And is the effect of vaccine really there in the people, or we are just basically having uh, no education about that? And Praveen Garg is asking about mixopathy vaccine, which is basically a vaccine cocktail. You take one dose for one vaccine, the second dose of second vaccine. I know it may be something which is premature to answer, but still would like to have your views on that, sir.